Chuma Mdeuka mafunde nakutala kunisize mulwazi Chuma Mdeuka on Masakhane exclusively on Vukani.
Right, imizuzu mathenzi beyi-23 ngoku ibethele intsimbi yaka phambi kobana kubethe intsimbi yaka 10 o'clock. I'm giving you the mid-morning radio. We call this one Masakhane, and I'm your host Chuma Mdeuka. Nditshile ke ndathi ke when we come back, we'll be talking about sepsis. Sepsis, often referred to as a silent killer, claims an estimated 2 million lives annually across sub-Saharan Africa, making it a major yet under-recognized health crisis. Despite its devastating impact, many cases go underdiagnosed and unreported, leading to missed opportunities for life-saving interventions. 13th of September is World Sepsis Day. To unpack this, we are now joined by Nadiya Ahmed from Medi Clinic. She's a general surgeon and an intensive specialist. Ma'am, good morning, and thank you so much for joining us.
Good morning. Thank you for having me on your show.
Yes. Today we are talking about sepsis. And when I was having a conversation with someone yesterday, I did ask, because I was so very much lost, that what is sepsis? And then he said that to me. Sepsis is how the body reacts negatively to an infection. But I want you to elaborate more about what is sepsis and how does it occur?
So it all
sepsis. And yes, Nadiya?
Sorry, it all does start with an infection and an infection process that can be caused by a variety of things such as viruses or bacteria.
Mm-hmm.
And essentially then it's up to our immune system and whatever medication we're taking to fight this infection. And so it's a combination of the two. And so if our immune systems are not good and we're not on the right medication, what happens is this infection becomes overwhelming for all the organs in the body and slowly leads to organ shutdown. And that's what eventually can lead to death. So that's exactly what happens in the whole process of sepsis and why it can be a killer in many patients.
Wow. I'm sure as you are explaining, someone at home is asking themselves that what causes this, what causes sepsis, and what are the risk factors maybe, if you can tell us that?
So yes, as I said, it comes about from an infection.
Yeah.
It can be viruses that are available, that are all over in the air, and we transfer this from person to person. It can even be from bacteria, which are also in our environment. So, the basics of preventing infection, and we learned this during the COVID-19 pandemic,
sure,
remains with good hand hygiene and sanitation. And that's the one way to prevent infection right at the get-go. Having said that, when there is a particular peak in viruses, especially during the winter months, etc., you will get the susceptibility to getting infection again. I think the biggest thing for the patient at home and the person at home is often we do get an infection. We often take medication at home and we go to the pharmacy and get something to help us along. And if our immune systems are intact and the medication is appropriate, we generally get better in 2 to 3 days. If it's not, or our immune systems are a lot weaker than we thought, then we won't get better in 2 to 3 days. And that's often when people carry on at home with medication instead of seeking healthcare treatment. So I think the message to the public is really, it's fine that you try a few remedies at home and go to your local doctor. But generally, if your immune system is good and if you're on the right medication, in 2 to 3 days, you should be getting better. If you're not getting better, that is when you need to seek help earlier rather than later.
Yeah, Nadiya, I'm an advocate for home remedies because I'm one person who always take time to go to the hospital because I had been there. So if you can give us the examples or the things that can assist me or someone who doesn't want to go to the hospital about the home remedies, what are the home remedies to avoid sepsis?
It all boils down again to good nutrition, which is very difficult in this day and age, and good hygiene is also very important. So especially, as I said, hand washing, avoiding contact with people who might be ill, and especially if you are immune compromised, coughing away all the lessons we learned in COVID-19. And in terms of nutrition, I mean, we live in a day and age where we live on a lot of fast food and junk food, and it's important that we are taking in enough of just not only the important things in terms of proteins and carbohydrates, but also all the micronutrients and all the vitamins that we should be getting in our diet should be there as well. And those are some of the ways we can strengthen ourselves in the fight against sepsis.
I heard that sepsis has an impact more especially on vulnerable populations like pregnant women and children. Key factors that put these groups at risk?
Remember, our immune system are little soldiers that are in our body, and children are still building their soldiers as they grow. So they have less soldiers than us as adults. So they're still developing that system. So unfortunately, sometimes infection can be overwhelming for them because they just don't have the number of soldiers they need to fight that infection. And then when it comes to pregnancy, it's a very dynamic process. And at one point, people thought that, pregnancy reduced the number of immune cells that we had and the number of fighting soldiers that we had. But now it's thought to be a bit more dynamic in its process. And we're still trying to understand exactly what it is about pregnancy that affects the immune system. All we know at the moment is that it does create a greater risk in those patients.
Nadiya, I want us to talk about the neonatal and the neonatal deaths in sub-Saharan South Africa. So, in your own perspectives, what steps can healthcare providers and police makers take to reduce these rates? Because they are very much devastating.
We've come a long way in maternal and child health in sub-Saharan Africa. A lot of research has been done, and we are keeping up to date with whatever protocols are there. In terms of policymakers and influential people in society, what I can say is that we need to support the research being done on local level, because we have a lot of information that's very peculiar to our country and our region that the rest of the community, the medical community, doesn't necessarily have. And it's only through learning what is happening in our environment we can guide policies. But we need that support from policymakers to support the people who are doing that work and doing the research so that we can gather that information and implement it appropriately for our people. The other thing is to have better antenatal services. We definitely need to promote that when patients get pregnant, that they go to antenatal clinics early on, and we need to have those more visible, particularly in our rural areas, so that people can attend antenatal clinic, and those that are identified at high risk can be seen sooner.
Yes, Nadiya?
And in terms of neonatology and the young babies that are born, we do need to support the specialists that are up and coming that are trying to specialize in this field of neonatology, because they are the experts in managing these very young kids.
Yeah. Tomorrow, Nadiya, is World Sepsis Day on the 13th of September. And I heard that you guys at Medi Clinic are raising an awareness about sepsis. Could you, but I want you to take us through to awareness campaign that you guys are busy with. It's Time TM, and how it helps to recognize early signs of sepsis. Can you take us through to that, please?
Yes, the most important concept of the Time TM is the time. If you remember nothing else, remember time.
Yeah.
The T standing for temperature. And that can be, we often focus on the very high temperatures, but we forget that in our immune compromised patients, even lower than normal body temperatures are actually a warning sign. It's not okay to have lower than normal body temperatures. So looking at the extremes, either very high or the low temperatures. Then if you have any features of an infection, so every person knows their body and they know where their body should be. You often will recognize, look, I'm feeling a bit hot or cold and it's really not appropriate. or I have a bit of a cold and I've got a bit of a cough and my body is sore. So when you start having signs of an infection, keep an eye on that and keep an eye on how long it takes to go away. The one thing that gets neglected often as a feature of sepsis is looking at our mental function, especially in our extreme ages, the very young and the very old. Generally, we often think the young kids that are just resting, they're just resting. But very active children, when they slow down, it's often a sign that they really are not doing well. And in the older population, if you look at even a patient that's just slightly confused or slightly disorientated, maybe a little bit more sluggish than normal, those are features that we should be concerned about, particularly when combined with infection. And the E stands for if you are experiencing any symptoms that are out of keeping for you. If you're suddenly experiencing a cough that's getting worse or more persistent and troubling, or you're having shortness or difficulty in breathing, which you never had before to that level, those are things you need to take note of. And when you put this all together, you need to think, okay, I've taken treatment for a day or two. Is it getting better? Is it getting worse? And if it's not getting better, then you should seek treatment, because it means that whatever you're doing is not helping you get along to get better.
Nadiya, it's World Sepsis Day tomorrow, and we're definitely going to raise awareness for that. But for me, I think that is not enough. What additional support is needed to combat the high mortality rates caused by sepsis, more especially in South Africa, in fact, in Africa as well? Yes.
We have to look at our healthcare infrastructure and our referral pathways and how we can, it starts from educating the patients to better education of our staff and healthcare practitioners on the whole of the subtle warning signs of infection. And that's been the big campaign internationally and even locally for the last couple of years, is that we work on guidelines and we work on acronyms like PIME, etc., to help both patients and healthcare workers recognize that these little subtle signs that we may ignore are actually important signs, and we should be sending patients on for care a lot sooner.
Nadiya Ahmed, General Surgeon and Intensive Specialist from Medi Clinic. Ma'am, thank you so much. I wish you a fantastic day ahead and filled with joy, love, and more laughter.
Thank you so much, and thank you for highlighting this important issue. Really appreciate the time.
Thank you so much. That was Nadiya Ahmed, a General Surgeon and Intensive Specialist from Medi Clinic. Namhlanje ke besixoxa about sepsis. Sepsis ke ngomso ke it's World Sepsis Day. Mizuzu mathenzi be 11 ngoku phambi kobana kubethe intsimbi yaka 10 o'clock ngentsimbi yeshumi. Zikhona ke indaba ngobunjalo bakho kungaphambili esikhululo sakho eVukani FM. Afuni tu tobana mabe uzawuphosa masivale ngohlobo.
Variety of music.